So welcome to this week's Med Talk. We're here with Dr. Heather Gessling. And one of the things that we thought would be interesting to learn a little bit more about is how insurance is a benefit and when in some ways it isn't. At the Wellness Company, we don't take insurance. It causes massive billing overheads that we'd have to pass on to all our customers. And so we use a model where it's essentially cash. And so we're here to talk to Dr. Heather Gessling about why that is and the dynamics and how your insurance may not be quite as beneficial as you might expect. So good morning, Dr. Gessling.
Good morning, Chris. This is a great topic to talk about because there's a lot of confusion about the benefit of using your insurance versus the benefit of going cash pay. And there is a big trend with direct primary care practices across the country to go straight cash pay, which is also sort of spilling over into going straight cash pay for things like labs and imaging, because patients are realizing sort of the insurance game. More and more know to look and compare what their pricing is if they go straight cash pay for labs or imaging versus submitting to insurance and having that contractual rate be submitted, and then they get a high bill because of their co-insurance, co-payment, or deductible. And they find that if they go cash pay, a lot of times it's cheaper.
How does that dynamic work? So in other words, you go to get a lab, and in our case, say it's a $400 lab and it's cash. I think you've been explaining there's a massive markup that goes to the insurance company, potentially a dispute. Yeah. You may or may not get the full coverage. And then you mentioned versus your deductible and all those factors. So if I go get a lab for $400, what's actually happening behind the scenes if I go to an insurance company?
The lab panel, for instance, that we at TWC are able to charge and get for $400 is probably, if you were to get that same panel and submit it through insurance, is probably going to be submitted at more like a $2,000 to $2,400 cost. There are contractuals. What different lab companies or imaging companies or clinics or hospitals have done is they've agreed upon pricing that gets submitted to the insurance. These contractual rates are very, very, very inflated. They're much higher than a lot of times what you can get if you do a cash pay rate, or in our case, the lab company that we use bills us, and we have this lower agreed upon rate between the two of us that we pass those savings on to our patients, our customers. And it's unfortunate that those contractual rates are so inflated, because with many patients, they have high deductible plans because this is mostly what they can afford because it lowers their monthly premiums. So when they have these high deductible plans, those contractual rates come back to the patient to have to bear the burden of, instead of it being submitted to insurance and most of it being covered. They get a large amount of out-of-pocket expense because of a high deductible.
The lab costs $400. I then submit a claim to my insurance company, or the billing occurs. And that,
but you have to be, when you say the lab costs $400, it may cost $400 for a cash pay. It may cost a completely different amount for if it's through insurance. So it has to be clarified where that $400 cost is sort of being charged.
Let's say that TWC $400 lab is billed out at $1,000, $2,000 because there's an agreement on what the insurance company is going to pay, and the lab is going to charge the maximum they're allowed, typically, if not always. And at that point, that is settled, kind of behind the scenes from you, the person who's insured. And you, if you have a higher deductible, are going to find that it's not going to be, that $400 TWC lab, it's a $2,000 lab on your insurance, you may end up paying more than $400 for because you have a higher deductible. Does that describe it right?
Well, yes, not only because you may have a higher deductible, but because when you submit to insurance, it goes at the contractual rate. So two different things happening. Yeah.
Gotcha. And in addition to that issue, for perhaps something like long COVID or other issues that TWC specializes in, the insurance company may not cover it at all. Is that accurate?
Yeah, I mean, that's fairly accurate, because whenever it's submitted through insurance, insurance has to approve whether or not that lab is justified by the code, the ICD-10 code that's used. In general, there are many codes that can be used to cover the labs that are ordered or submitted. Sometimes, if you don't know, how insurance or billing works very well, there could be a lot of hassle in order to get those labs covered. I mean, that's the way the insurance world is now, because they become more and more picky about what they're going to cover, about what codes they'll cover, about what testing they're covering. And they're basically acting as that sort of intermediary of care. The physician wants one thing. The insurance company, of course, we all know, says, well, no, we don't really find that justified. We don't really think that what you're ordering is necessary. And the insurance company is deciding that. So at TWC, we see the game that the insurance plays, and that game that the insurance plays costs providers and companies or clinics a lot of money, because they have to have dedicated personnel on staff to be able to handle all those claim denials. In general, the costs are probably going to be lower if you don't use insurance. In general, the costs are lower for the company if we don't submit to insurance. So all around, it's a win-win. There are very few instances, though, in my opinion, where patients are going to need that. I mean, in the event of a traumatic injury, in the event of a cancer diagnosis, in the event of a very, very severe illness, but most likely, if it's not cancer or trauma, a car accident, most of the time you don't need that catastrophic insurance or a hospital. You can, if you have a good doctor. And I want to say another thing. So when I was preparing for this talk in my mind, I was thinking, what would be a good analogy for patients to sort of have and understand in what I am trying to convey and explain? So I was thinking, okay, so we have homeowners insurance, and you get a hailstorm, and you have a damaged roof or a destroyed roof, and you need it replaced. So you go to your insurance company and you say, okay, I've got this damaged roof, and they say, okay, well, you can only use this one contractor or two contractors, and you look them up and they have terrible reviews, and you don't want to use those contractors because it's not going to fix the problem. They don't do a good job. They don't know what they're doing. Their expertise is terrible. Maybe they don't even have the right training. And so, but you're forced into using those contractors in order to get it approved through your homeowner's insurance. This is what is happening with our insurance world right now. They're controlling care. So patients are learning more and more and more that physicians that are sort of following the mainstream narrative agenda and not recognizing certain conditions are not the ones they want to utilize, or the ones that they want to utilize, are now sort of outside of that system and not using insurance. I mean, this is what we're living in the medical world, where insurance has way too much control. They're denying way too many things. They control care way too much.
So if I go to a doctor and the doctor recommends some labs, some treatment, and it goes to the insurance company, and the insurance company denies the coverage, do I then have to work out a settlement with the doctor? Am I going to pay the full bill that they would have sent to the insurance company? Is that potentially the risk then if the coverage is denied?
Well, a lot of times it's not going to be, I mean, a lot of times if it has to do with a service, they will work on an agreement for a reduced rate. I mean, this is what hospitals do all the time, you know, if things are not covered by insurance. There are these things called advanced beneficiary notices that are very commonly signed in doctor's offices or when you go get a lab, they'll have you sign it, where once they submit to insurance, if insurance denies, then it's the responsibility of the patient. Usually that rate is going to end up being lower. It goes back to that whole contractual thing where, you know, there's this agreement between the lab or the provider, the hospital, the clinic on what they're going to submit, what rate they're going to submit. And that happens behind the scenes. That contractual rate gets decided long before behind the scenes. But when it comes to the responsibility of the patient, a lot of times it's going to be a different number.
So then, why the wellness company? So you mentioned that this $400 lab from the wellness company that might be part of perhaps long haul COVID or vaccine injury or optimal wellness. Why is that an advantage, and why would you want to do that over going through insurance if you have insurance?
A lot of the conditions that we're treating, it's hard right now to find physicians that are willing to recognize those conditions, understand how to treat those conditions. And so our company has providers that understand and recognize what the condition is, potentially ways to treat it. There is no perfect 100% way, but we have, you know, pretty good, we're learning more and more every day about how to treat, you know, conditions like long haul COVID or vaccine injury. And so you may be having trouble to find a physician that will treat that. We have those physicians, and we also have the expertise on knowing sort of the underlying condition, or excuse me, the underlying conditions that need to be evaluated by lab work. So that lab work, I mean, like the panel for long haul COVID and vaccine injury includes 20 labs, and some of them are pretty expensive labs, and we're able to get that at a very, very good rate. And like I said, comparably submitting that lab panel through insurance could be 5 to 10 times higher, and very, very commonly it would be 5 to 10 times higher. So if you have a high deductible plan, you're probably going to end up paying the same amount for that lab panel as you would for the lab plus the physician cost, maybe even more.
So you're going to pay the same amount, and you are not necessarily going to have a specialist or a person with expertise in dealing with those panel results as it relates to long haul COVID, vaccine injury, or one of these things that we specialize in. Is that accurate?
Yeah, exactly. Yeah. Mm-hmm.
Well, great. Well, you can find out more at twc.health. And Dr. Goessling, thanks for talking today.
Thank you, Chris.